Good afternoon. Thank you again for coming in. I really appreciate you taking the time. My name is Cicely, and I'm going to be the social worker working with you today. I'm here to kind of support you and gather some information so that we can really determine the best course of action to get you through what you're currently experiencing in the best way for everyone and in a way that you feel comfortable. So, just so everything is clear and we understand the expectations, I just want you to know that this is a confidential and safe place. Nothing that is discussed here is going to be discussed elsewhere, with the exception of if you are at risk of harming yourself or others, as well as any suspected abuse or neglect. Does that clarify? Do you understand everything?
Yes, ma'am.
Okay. Do you have any questions about any of that?
I do not.
Okay. So the purpose of really today's session and as well as probably the next session or two is really a lot of information gathering. It's me getting to know you, getting to know what you're experiencing, and some historical aspects. So it's going to be kind of like a lot of questions. And at any time, if you feel overwhelmed or you're not comfortable answering, just let me know. We can pause or do whatever we need to do. Are
Okay.
you ready to get started?
Sure am.
All righty. So let's just start with the basics. Let me know why you're here to see me today.
I've been having a lot of issues recently. Like, I have constant thoughts about my feet being dirty and needing to be cleaned multiple times a day, even if I'm at work. Um, and it's creating a lot of anxiety for me. Like, I feel like they're always dirty. Like, like, I need to get them clean, but I can't get them clean enough, if that makes sense.
Yeah,
Um,
absolutely.
and then I'm just like, I'm afraid that if I don't, they'll be infected. And I have this mix and stuff I spray at home. Like, I really just, something about my feet. Like, I can't, it is something that I just can't deal with it. Like, I just feel gross.
Okay. Well, let's dive a little bit more into that and see if we can't kind of get a better understanding of that, or maybe some things that have maybe created this current situation. Or sorry, I got a little froggy in my throat. So let me ask you this: so when did these symptoms, first start occurring? What are current symptoms versus maybe some historical symptoms?
So I first started having the symptoms when I was about 14, and then started having and then the compulsions like with the cleaning feet had to start. They started later on, a few years after that. But I've had it for about 10 years now, and then it's gotten worse in the last 5 years. Um, I would just start off with washing from a few times a day, like lunch, like when I just go wash my feet real quick, and then or at bedtime just to make sure they were clean before I get in my sheets. Um, and then I would always change my socks and not think anything of it. I didn't want them to be dirty. Uh, Now the severity of it, I guess, is it's gotten to the point where it takes me like an hour or more a day, and I constantly am wanting to make sure that they're clean, and they have to be clean. They have to do. They just I can't get them clean enough. So it does help. It kind of like sucks because it eats into my work time. It prevents me from going to a lot of places because I want to wear cute shoes, but I also can't wear cute shoes. But I think my feet are going to get dirty. So then I'm kind of like, well, I'm going to stay home because that way they're at least clean. And then like you can't go out to the beach or the pools because then your feet are going to get dirty. So it's a lot.
Yeah, it definitely sounds like a lot, and it sounds like it has really kind of progressively gotten worse, especially in those last few years, and that it is starting to become, impactful in your life, in your work, your social life, and just kind of in general. It's taking up probably more time than you would like to devote to this. So yeah, definitely a lot, and sounds like you're kind of ready to figure out what's going on and what can be done. So let me ask you some other questions just about some other things, and these are questions that we ask everyone. So please don't take offense or think that these are geared towards you at all. So are you currently using any substances, including illicit drugs or alcohol?
No, ma'am. I don't do drugs. I've never done those in my life, actually.
Okay.
And yeah, no,
Okay. Are you currently, like, do you have any current medical diagnoses or on any daily medications?
I do not. I don't even. I take vitamins. Maybe that's about it.
Okay. Have you ever had any significant medical history, like any injuries or illnesses that have maybe required you to be hospitalized?
Not that I'm aware of. No,
And definitely none specifically like to do with your feet. You've never had, an ingrown toenail or anything like that.
no, not really. It's just my feet are ticklish. Does that count?
I will definitely know that, but I don't know that that is a qualifier as a significant illness with your feet. Um, so, can you think of any sort of a significant event that may have occurred either around the time that you first started having these thoughts when you were 14?
I can't. I don't. I don't think of any right now. Mm-mm.
Okay, so it would be safe to say that you just feel like this was kind of a sudden onset, like around the age of 14, you just started
Yeah,
having these thoughts about your feet. Okay. What about in the last 5 years? Was there any sort of a significant life change or any sort of major event that occurred, 5 years ago that may have facilitated kind of the increase in the severity?
I don't think so. No, it just kind of just seemed to progressively get worse.
Okay. So now just a few questions kind of about your overall mood and things like that. When you are having these thoughts or these urges, or this need to wash your feet, like what type of emotion would you feel like is predominantly there?
Just kind of like anxiety. Like I got to I have to get them clean. Like I have to do this in order to be able to function. So I have to um really that's the only emotion I can play on. Like because not they, my feet, no, not my, yeah, my feet. Um, I just feel like I can't do anything properly if I don't have clean feet. So it's just anxiety. Like I feel like I'm gonna like my feet are gonna stink. They're gonna be dirty. They're gonna do. It's just it's a whole list.
Okay. So it sounds like obviously anxiety, you definitely feel anxious about that. When you are um, unable to, or there's a delay in actually going through with being able to wash your feet and changing your socks, is there any distress or like discomfort that you feel in your body?
There is. I always feel like I'm gonna get infected, but I also feel like if I cannot get them clean, that I'm just like it heightens my distress level because I just feel like it's just gonna get worse and worse, and then it'll eat at me, and I'll just be sitting there, and then I can't do anything. I can't focus on anything else besides that.
So it is definitely a barrier, during your daily function. Okay. Do you have any other sort of intrusive thoughts about anything else? Is there anything else that you seem to kind of think about frequently?
No, just my feet.
Okay. And no other like really strong urges or compulsions to like do anything else? No counting, or you don't feel like you have to do things in a specific order?
No.
Do you have any other sort of thought patterns about anything else that may, similar to how you feel about your feet? There's nothing else that you think about, and then you have to do something in order to kind of alleviate those thoughts, or for fear that something may happen.
I don't think so.
And no, like hearing of voices or seeing things that people have maybe told you aren't there.
Oh no, ma'am. No, I don't. Mm-mm.
All right. And then also, again, just common questions that we ask everyone during this process. Have you ever had any feelings of self-harm or suicidality or any homicidal thoughts or actions?
Um, no, I don't. Not that I can remember.
Okay. All righty. Have you ever had any sort of treatment for anything like this previously? Have you ever seen a psychiatrist or a therapist prior to this?
No, ma'am. This is the first time I've even attempted to come in for treatment. I thought it was kind of just normal, and I just kind of dealt with it. And then when it got progressive, I kind of started worrying a little bit about it more. And now I realize that I need to seek treatment now.
No, absolutely. And it's good that you have recognized that this maybe isn't a typical thought process and that these aren't necessarily typical actions. And so that's great that you are able to recognize that and willing to take these first steps to really kind of explore that and see what we can do, to help lessen this burden and this intrusion in your life. So because you've never seen a psychiatrist previously or a therapist, is it safe to assume that you've never been prescribed any psychiatric medications, and that you've never been hospitalized for your mental health?
No, ma'am. Never.
Alrighty. Um, Alrighty. So let's talk just a little bit about your family history and maybe some of your own, social history. So, is there any sort of a family history regarding any mental health diagnoses that you know of?
Yeah, my mom was diagnosed with OCD.
Okay.
Um,
Um, oh, go ahead.
no, that's the only thing I think. That's the only one I can think of. It's just my mom.
Okay. And what about any substance misuse? Has there been anyone in your family that ever had any issues with substances, including alcohol?
No, ma'am.
Any other sort of psychiatric or mood-related disorders with any like second degree relatives?
No, no. Just the only one I can remember is my mom.
Can you tell me just a little bit about what that looked like in her life? Was that something that was obvious to you all? And at what point did she get that diagnosis?
I think she was a little older, but not like she wasn't a kid. I know that, but she would just do things like repetitively. She had to wash her hands a lot, and they would get to the point where they were chapped in like the wintertime because she would wash her hands so much. So
Mm,
she could not stand the thought of getting her hands dirty, or if like something touched them, like meat or anything, she had to clean them immediately, and she had to do it very thoroughly with very hot water.
okay. And I assume that you witnessed these behaviors.
Yeah, it kind of grew up as a habit. Like we would go to the bathrooms constantly with her, just because she would, and we got told to wash our hands all the time. We were very clean kids.
Okay. And so you don't have any of those thoughts or behavior patterns with your hands, just your feet?
Yep, just my feet. My hands are. I mean, I wash my hands, but no, it's just my feet.
Okay. All right. And then as far as any experiences growing up, did you ever witness or were you ever exposed to any sort of domestic violence within your home or even outside of the home or any type of child abuse?
Oh no, no, ma'am. We don't have a very big family. Like I have one older sister, and then my parents are, but we were all very close growing up. But no, there was no domestic violence or anything like that. My parents loved each other.
Okay. All right. Well, and so it sounds like you grew up in a traditional two-parent home with just the one older sibling, you said,
Mhm. Yep, older sister. Mhm.
right? And if I'm correct, you guys had a very, positive relationship. Um,
Oh yes,
is it
I
safe
mean
to,
yes.
okay. So it would be safe to say that they're probably still a good support for you?
Oh yes, ma'am. Those are my rocks. I call my sister all the time.
Okay, great. Well, that's good that you have such a solid, support system there. Um, Real quickly before we get further into your social history, do you have a history or do you currently use any substances? I know we kind of just very briefly touched on that earlier, but have you ever used any substances, including alcohol, in the past?
No, ma'am.
Okay. Never even just like a drink when you were a teenager trying to explore or anything like that?
No, ma'am.
Okay. All right. So, what about any sort of marital history? Have you ever been married?
No. I've never been married and um, no actual relationships really either. Nothing that stands out. It's just kind of focus on me. Do stuff for myself mostly.
Okay.
Help my parents. That's about it.
Okay. And so do you have any children?
I do not. Not at all. I have a niece
No.
and nephew though.
Okay. Are you close with them? Do you get to see them a lot?
Yes, I do.
Okay. How frequently would you say that you get to spend time with your family?
We have weekly dinners, so we're very close. We all live around each other, and so we get to see each other on a regular basis.
Okay, that is fantastic. It sounds like they are a good support for you and they are close by as well, which is also helpful. Tell me a little bit about your educational background.
So I graduated college. I have my bachelor's in science, and I work for a public relations firm as an accounts liaison. I'm sorry,
Okay.
and I've been there for about 2 years.
Okay. So do you enjoy that atmosphere, the company that you work for, the position that you have? Is that something that you enjoy?
I do. I like numbers, so it works really well.
All right. And have there been any sort of family-based stressors or any sort of work-related stressors in the past few years?
I did just recently buy my first home. Uh, Moved out and decided it was a time to be an adult and buy my first home.
Okay, well, that certainly can be a very stressful time,
Very.
being a first-time homeowner. Well, the whole process really from looking to closing and then owning a home. So how long ago did you buy your home?
Within, I say within the last year or so.
Okay, so
Uh,
very recent. Mhm.
yes.
And how is that going?
Um, it's an adjustment. It's not my little apartment anymore. It's actually you don't get to call the landlord if you need something fixed. So it's been a little stressful because if something breaks, I do have to fix it, or I'll have to call my dad.
Yeah, absolutely. It is definitely very different.
Mhm.
Um, so have you ever had any sort of history of military service or living abroad?
No, ma'am. Not. No. I would love to live abroad, but no.
I think we all would like to live abroad at times. Okay, and so we did also talk a little bit about your support system. So we said that your family is a large source of your support. Is there anyone else that you consider part of your kind of safety net or your support system?
Yeah, I have a good friend. Well, my best friend, pretty much. I've known her for about 12 years.
Okay,
Um,
and how frequently do you guys communicate?
we communicate all the time. Like we send each other TikToks every day. But we communicate on a regular basis. She doesn't live as close, but she's still close by. So we just have to
Okay,
make time to see each other.
okay, and so even though you don't necessarily get to see her face to face, she is definitely someone that you would consider, someone that you could count on that would be able
Yes.
to be there and help you out. Okay, perfect. And I'm going to assume since you've known her for 12 years that this is someone who potentially is aware of these thoughts and these behaviors around these thoughts, or is that something that has not been discussed with her?
No, she's seen it because it does prevent us sometimes from going and doing certain things. So she knows about it because I had to tell her. Because I didn't want to keep explaining why I couldn't go certain places. And yeah, so she knows. And I thought she was going to think I was weird for it, but she was proud of me for coming to get help. So
Okay. And how did that make you feel when were faced with the choice of having to kind of let her in on something that was probably, very personal, and anxiety inducing for you, but to know that she wasn't going to necessarily treat you or look at you any differently?
well, at first it was stressful, like knowing that I had to tell her, but it was a really good relief that she didn't think I was weird and she didn't judge me. And I appreciate that a lot.
Yeah, absolutely. I bet that that was very relieving to
Mhm.
one kind of, get a little piece of that out there, but then to also know that it really wasn't going to change anything between you two. So what are your current methods of self-care and stress reduction?
So I meditate for to relieve stress. It just kind of helps me relax, and it's just meditation actually just helps me the best.
Sure, absolutely. And everyone has definitely their own ways of self-care and coping with various stressors in their life. So how long have you been doing meditation?
Probably right after I bought my house.
So that's also something new.
Yes.
No, but I can completely understand that. And how effective do you feel like that is for you?
It's very effective. 'Cause it kind of gives me time to like kind of, because I can just kind of, I was gonna say expel, but it was saying excel, and sorry, expel like my stress and kind of get it like, okay, it's gonna be all right. It's gonna be all right. Just breathe. It's kind of like a reminder to breathe. So it works. It works really well for me.
Absolutely, taking that time because sometimes we do forget to just like stop and take a breath. Have you ever tried meditation or any other coping mechanism with your thoughts about your feet and some of those behaviors?
I have not.
Okay.
That would probably be a good idea to use that.
Yeah, well, and that definitely may be something that we incorporate in our plan of care, and maybe some various ways that we can kind of go about this. Any history of legal concerns? Have you ever had any legal problems?
No, I'm pretty straight now. I don't want to get in trouble.
As most of us don't. Um, okay, and we already talked very briefly about your medical history. You have, and just as a recap, and so that I can make sure I've captured everything, you have no significant medical diagnoses or concerns. Is that correct?
No, ma'am.
Okay. Do you have any medical diagnoses at all?
Mm-mm.
Okay. And you've never been prescribed or given psychiatric medications, and you're not on any current medications. Have you ever been prescribed outside of like an antibiotic or something like that? Been prescribed any sort of a daily medication for anything?
No, ma'am.
Okay. No hospitalizations, you already said. Any history of head injuries?
No.
Okay. And are you allergic to anything?
Yes, just dust mites and penicillin.
Okay. All right.
Nothing. Nothing too crazy.
Okay. Well, I think that that really kind of covers it for today. It definitely sounds like you have some intrusive and unwanted thoughts, and they are persistent and involve you kind of performing almost like a ritual, ritualistic washing, a compulsion to do that, that happens multiple times a day, and that you have to do these things to, reduce your anxiety. And that if you don't, or if that is delayed for some reason, then that just really kind of increases the distress and discomfort. So I feel like at this point, we might be looking at some obsessive compulsive disorder. And I know that that can sound kind of scary because of things maybe that we see or that we read, but I want you to know that it is actually, fairly common, and with the timeline given, it definitely kind of matches up. We typically see these things kind of at an onset, especially in females around the age of 14, and they can progressively get worse as well. So, um, but I would like to take the next couple sessions just to gather a little bit more information, a little bit more background, just to make sure that that's correct before we really start developing a treatment plan. Because I certainly don't want to waste anyone's time by jumping on something and then that really not be what's happening. So, if you are okay with that, I would like to go ahead and have you come back so that we can kind of continue this process and start working towards creating a treatment plan.
Yeah, that would be okay.
All right, sounds good. I will have Nancy up front get you set up with a next appointment.
All right.
All
Thank
righty,
you.
thank you.